The Advanced Therapeutic Center is our title for our kind of department within the practice that deals with our cancer patients. So whether it be the providers, the nurses, the nursing staff that work primarily with cancer patients, whether it be some of the service lines we have, so our infusion treatments, our oral drug program, our imaging program, and then, really all of it feeds into each other. You see one patient that has a cancer diagnosis, and what we try to do is we try to vertically integrate all of the things that will help that patient under one roof so that we can have shared resources and really familiar faces and staff to these patients as they're going throughout the process. The goal is not to try to say, well, this patient needs to be treated over here, or only a few providers should be treating these patients. What we're really trying to do is provide a resource for all of our doctors, and really a resource for our community, because what ends up happening is we get referrals from radiation doctors, medical oncologists, primary doctors. And so we have now the backbone or the infrastructure to be able to manage these patients, I would say, in a very cutting edge way. And we were one of the first practices in the country to really operationalize a checkpoint inhibitor program where patients come, if they meet the criteria clinically, we have them meet with a provider and an oncology nurse to really give them all the education about what it would entail for them to get those treatments here in-house.
So the research department is largely focused on phase 3 trials, but over the last 10 years with growing experience, besides just registrational studies, we've started phase 1 and phase 2 studies, which are sometimes dose-finding studies or the first steps in proving efficacy of the studies. Once we determine the drug or the new investigational agent is safe, then we work to determine that it actually has promise for those cancer therapies. The whole point for us developing an ATC department was really to be able to transition those things which were next generation from the research studies into actual clinical practice and open them up to a broader patient group. Clinical trials tend to be a very focused, lots of inclusion-exclusion criteria, and so we're not able to offer that usually to all of our patients. And so with the ATC department, we take those medications and can see them for referral for all of our providers and all the patients that are under our entire umbrella network. I think the local community care for the average cancer patient is elevated across the entire practice by having an advanced therapy center. The research and the ATC enables us to pass down the newest technology to our local community cancer patients in a way that you may not be able to get in a smaller community. And really that's the benefit of having this in-house growth over the last 10 to 15 years.
I think ATC is unique because we're able to provide care for our patients in one central location. Well, we have obviously our cancer department, but in part of that we have our IOD, our in-office dispensary, where we can prescribe medications for our patients. We also have a PET scanner that we can do imaging in office. We also participate in sample and voucher programs, as well as staying up to date on any patient assistance programs that are given for patients. We all know that there's a financial burden that comes along with a cancer diagnosis, unfortunately, so we do try to offset that for patients with those. Again, with the PET scanner, we do our prior authorizations in office. It's been able to help us to be more efficient in getting patients in sooner, so that's been really helpful. And again, the research department is a huge facet for us too.
Patient care is very personalized. No patient is alike, no one is the same, so we really want to gear our treatment plans towards the individual. Everyone comes from different backgrounds, so we want to make sure that we are gearing towards, like I said, the individual. And we're making sure that each treatment plan is coordinated to what they prefer and what will help them in the end. I've really seen the center's treatments benefit the patients just from seeing patients achieve remission. When they start out here, they have a cancer diagnosis, it's scary, it's unknown, and we help them by providing a treatment plan, working through them with each appointment, phone calls to check in on them, helping manage side effects, and then seeing them achieve remission, or if one treatment plan doesn't work, gearing them towards something else that might be more appropriate for them.
The center is an evolution at its core, and we really are trying to anticipate what's next. Hence the focus on research and looking into what is the next thing available. One of the things we see frequently in our office are patients coming from far away or coming as part of a second, third opinion. They have seen other higher end medical centers and they come to us and say, well, what do you have that's new? What do you have that we haven't heard of? I get that question quite a bit. And so it really begs that question of where are we going next? And so, right now, the hot things in prostate cancer, we talked a little bit about radioligand therapy, utilizing a PET scanner in-house for both treatment and diagnosis. We're seeing similar advances in PET imaging in renal cell carcinoma, kidney cancer. And so we are excited to be able to bring some novel imaging platforms in-house such that our patients who have these diagnoses or these conditions could potentially get managed at a really high level in-house. The future, I think, looks really bright and continues to address what's new and what patients are going to need in cancer care. There is a real nod to being able to do it in a little bit more of a simplistic, patient-centric way. And overall, I think the strength is the people, the relationships, and the fact that our menu of services is really, really growing. The quality of our staff, the quality of the doctors that we have, and the nurses we have providing this care is exceptional.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.